Hello, my name is Laura MOSQUEDA, and I'm delighted that we can show you what the next phase of your training could look like.
Keck School of Medicine, we pride ourselves on challenging paradigms and thinking outside of the box.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
The training you get here is as hands-on as it could be.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We take on the toughest challenges, the toughest cases. We take on the biggest questions for research to try and make a difference and improve human health.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interest supersedes self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Yes.
These are the patients that, you know, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Dix in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, But equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever. We really want an inclusive environment where you can be the thought and the change leader on our campus.
If you come to USC, you will be part of a close-knit, collaborative Trojan community.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Hi, I'm Maddie Ross. I'm one of the fourth-year emergency medicine residents at LA County USC, and I'm one of the chief residents as well. I'm up here on the helipad. I've got beautiful LA's downtown city skyline behind me, and I've got Old County General Hospital looking down at us. I'm really excited to take you into the department today and show you a little bit more about our program. Right here, we're standing in our ambulance bay. So some of our sickest patients will come right through here. They'll be wheeled directly into our ambulance receiving, our ambulance triage area.
GARRANZA. I'm CARLEE. I'm a resident physician. So right now we're in one of our resuscitation bays. It's Recess 2. We're in an area that has 12 beds where we see usually the highest acuity of patients that come through the ER. It's an area where we'll see all of our sick traumas, our medically complex patients, and where we're doing a lot of procedures when people are coming in, and we need to be ready to handle whatever could come through our doors. So we have ultrasound machines in every room. We're able to convert these rooms, if we need to, into an area where we could perform surgical procedures. A TTA stands for a trauma team activation, and it's when somebody who's critically ill from a trauma comes into our ambulance bay, into one of these rooms, and it seems like it can be chaotic and there's a lot going on, and we have really critically ill patients, but it's pretty amazing to work with both the trauma surgeons, the ED residents, our attendings, come together as a team and see some of the sickest patients I've seen in my career.
This is actually one of the oldest emergency departments in the country. This department was started in 1971, and since then has trained over like 650 practicing emergency physicians across the US, across the world really. Next would be North, which is a pod that takes care of kind of all your classic emergency medicine patients, your chest painers, belly painers. We take care of kind of the entire spectrum of acuity within North.
Hi, my name's Simone. I'm from Massachusetts, and I'm a third-year resident in the Emergency Medicine Residency program at LA County Hospital. So we are standing in front of North right now, and this area is sort of like the bread and butter of our emergency department. This area is really unique for a couple different reasons, one of which is how we staff it. The interns and third-year residents in our program have a really unique, close working relationship in this department, where they work one-on-one on the B side of North, and really develop like a close working relationship with one another that forms a bond that then spans the remainder of residency for both of those classes. It's an area where I'm humbled every single day, where I see things that surprise me every single day, and where you really get a chance to have like meaningful interactions with your patients. A big part of it is just knowing what it feels like to sit with someone in a period of time that might very well be that person's worst day. And knowing how to meet people where they're at.
My name is Mike MESSINA. I'm one of the second-year residents here at LAC+USC Emergency Medicine, and I'm originally from Ohio. Yeah, so West is a very unique area. So typically it's staffed by some senior resident, either a third year or fourth year, and then you'll often work a lot in here as an intern, and then sometimes we have a PGY2 as well. This is one of our busier areas of the emergency department because we tend to see lower acuity things here. We see a lot of broken bones, a lot of fractures here, a lot of eye complaints, glaucoma and corneal abrasions and weird eye stuff like that. Gynecologic complaints, a lot of pelvic exams happen here, abscesses, LAC repairs, you name it. Like, this is your area for bread and butter small emergency procedures. So the volume and pace is really fast. But for these people who don't have a primary care provider, like, we are the help that they need, and they need to be seen for these things.
We have a really unique, fully separate emergency department housed within our walls that cares for incarcerated persons. We call it our jail ER.
My name's Scott KOBNER. I'm a fourth year here at LAC+USC. I'm the education chief. So we're standing outside of the jail emergency department. It's a really unique part of our program in that we provide all the emergency medical care for anyone who is detained in the LA County corrections system.
We have a pediatric ER that is its own separate pod to kind of foster an environment best suited for the care of children.
Hi, my name is BEZA. I'm one of the second-year emergency medicine residents here at LA County, USC. This is a 14-bed pediatric emergency department, so we see anywhere from pretty much birth to about 20, 21 years old. Instead of a few other programs that I interviewed at where they will have their pediatric blocks, so they'll just have summer blocks or winter blocks. We get to see them throughout the year. And so amongst our interspersed shifts here at LA County, we do a month at Long Beach Memorial where we're actually in their emergency room. We also have dedicated time in the pediatric ICU as well. And so on top of seeing things throughout the year, we also have dedicated time where we're learning from the specialists. There isn't much you can leave here and not be ready for.
I think one thing that's unique about this training program is that it's always been a resident-driven program. And so we have incredible faculty and staff and teachers, but we like to say we're residents trained by other residents.
Our program, one of our emphasis is graduated responsibility. So when you come in as an intern, you learn the basics. You basically learn to walk before you can run. And then each year, the level of intensity or difficulty of what you're doing goes up so that by the time you're a PGY4 or fourth year resident, you're ready to run this area.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible, both as my development as a human being, as a physician, as a friend, as a scholar and academic, all of those things this place tests in your own unique ways.
And I think that's really unique. And LA County's hospital was kind of founded and built with that same purpose. It was kind of commissioned by the East Los Angeles community to be a place that all could be treated regardless of their ability to pay. And we're kind of in this new fancier building many years later, many years after kind of the great stone mother was built here in Los Angeles. That mission, that purpose is just as alive today as I think it was when this place started.
They're my people. I see myself reflected in the population. I also see that it's some of the most underserved communities, and so it's nice to be able to take whatever skill set I've developed over the years and be able to give back to the area that raised me.
But just showing up every day with compassion, with empathy, with the strongest work ethic you can muster, because this place asks that of you and so much more. But I think that what you get back in return from this program goes above and beyond.
It's been an incredible experience. The days are very, very long, but the years are incredibly short, as I guess that adage goes.
You know you're ready. You know you have worked in one of the busiest ERs in the country. You've treated some of the sickest of the sick. You have cared for people who had nowhere else to seek care. You've learned from some of the greatest teachers in this specialty, some of the founders of this specialty, and you've worked alongside people that come to work every day with that shared purpose, that shared mission, and it certainly feels like a family.
It's been a great place, and every time I come here, it's reaffirmed my decision every day.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve, and they're the reason that I get up in the morning. It's great to become a good ER doctor and get all this training, but it's even better to come to work and be able to serve our patients and give them the care that they deserve.
So I know, at the end of 4 years, I probably won't be emotionally ready to leave this place or this family, but I know I will certainly be ready to practice emergency medicine just as I always hoped I would be able to.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is,
be assured that you are going to be the most well-prepared person possible for that next part of your career.